Elizabeth, go ahead. Let us know about this
Yeah.
case. You want to just kind of take us through it?
Yep. So there was a 45-year-old female who was referred to me from another clinician who had been treating her for several visits for back pain and bilateral plantar fasciitis. And so the therapist that referred her to me was hoping that maybe I would just be able to take a look at her feet, because I have also molded people for orthotics, and maybe she needed like an adjustment or something to the orthotics. So the first visit was early December with this woman, and her background is she's a speech language pathologist. She reported that she had had back and bilateral foot pain really since her pregnancy 16 years ago, with these intermittent flares. And she felt like the back pain could be worse without affecting the foot pain, and vice versa. So she didn't necessarily feel like they were connected. And that kind of the transition to me was not necessarily that I was going to be looking at her back, but really was that I was going to be taking a look at her feet and maybe making some additional adjustments to these orthotics that she had been given. So looking at the sheet, the pain started like with her first pregnancy 16 years ago. At the time she saw me, she had bilateral foot pain, not just in the plantar fascia, but kind of the whole plantar surface. She felt like the right foot was worse than the left. The right foot was a 2 out of 10, the left foot being a 1 out of 10. And the back pain, which was just kind of lower back, maybe sacral area, nothing in buttocks, was a 2 out of 10 at the time. She felt like she was not able to really kind of increase her walking or standing. She was limited with hiking and cleaning her house. She felt like things were either unchanging or getting worse. And the symptoms at onset were both back and feet. In terms of a spinal history, she did say, she had a flare of her back pain about 3 years ago when she did a ropes course, but also had a long car ride. The constant symptoms, she felt like she had constant foot symptoms. So even at rest, she would have this, but the feet would get worse with activity. And stop me if I'm missing anything, but I'm just moving down to the worse, better section now.
Did you say that the foot is constant? Is that to imply that the low back is intermittent?
Yes. So the low back, I would say, is frequent, but she did say it was intermittent.
Okay.
But the foot pain was constant.
Okay. And you said bilateral, is it always both feet, or are there occasions where she only has one or the other?
I don't know that I really asked her if she would have the right foot without the left foot, but she had only indicated that the right foot was typically worse than the left foot. In all the times I've seen her, she's always had bilateral.
Yeah. Okay. The 2 out of 10, the 1 out of 10, that's interesting to me. Does it ever reach higher intensities?
It does. So I had asked her, to rate it at its best, which was that 1, 2, and then at its worst, she had said an 8 out of 10.
Okay, yes.
Did she say if her right side of her back was worse than left side of the back?
She did not say that in the body diagram. Again, my picture, and she just kind of confirmed that looked okay, really just went like right across top of iliac. But as the story kind of progresses, she's also had a lot of treatment for her sacroiliac joint. So she really feels like the pain is kind of SI area, but she really talks about more low back, or that's where she points to.
And Elizabeth, can I ask you, at this point right now, just from what you've given us, what were you thinking? Yeah. Where was your head into?
I know. So I wrote at the top, I was like, okay, this could be lumbar, and I'm thinking lower lumbar because of it going into the feet. I had just put on the top like lumbar derangement versus question mark like bilateral ankle derangement, or is this really like a bilateral plantar fasciitis? And I should say that and I'll get to this in the postural piece, but she does have increased pronation like pes planus bilaterally.
Month after month, new guest experts sharing actual patient cases and subscribers sharing their own challenging and interesting cases like Elizabeth is in this one. Check out case conversations at mechanicalcareforum.com.